Welcome to the second part of the series Autism Can Be Cured If. In this episode, my primary goal is to demonstrate how children with autism have shown improvement through the use of constitutional medicine, a method that shifts the narrative from no cure to there is a cure. This approach, which harnesses the healing power of nature, has the potential to improve the lives of millions of autistic patients worldwide, yet remains largely unrecognized in conventional medicine. Patients with autism in my practice have shown significant improvement through constitutional medicine. On August 20, 2023, parents consulted me about their 9-year-old son who was diagnosed with childhood autism at age 2 and lives in Wisconsin, USA. He had been part of the Wisconsin Early Autism Program, WEAP, receiving behavioral, occupational, and speech therapy. These therapies initially enhanced his motor skills, but his development eventually reached a plateau. The primary challenge was communication. Although his comprehension was satisfactory, he primarily used gestures, pointing to the kitchen when hungry, to the cupboard for noodles, and showing a car when he wanted to go outside. He also had bouts of anger during which he would pinch those nearby, and then tried to comfort them. His perpetual movement showcased his hyperactivity, with behaviors such as jumping on the bed, moving constantly, and banging his head against soft surfaces. His teacher reported his inability to concentrate, easy distractibility, and frequent frustration. Moreover, he had been passing black, pellet-like stools for the past 4 years. My evaluation suggested that his diagnosis of hyperactivity, commonly referred to as Attention Deficit Hyperactivity Disorder, ADHD, was incomplete. He also displayed a high level of meticulousness, organizing his toys methodically after playing, which was misinterpreted as obsessive-compulsive disorder, OCD. The symptoms guiding the identification of his constitutional medicine included his constant restlessness, wrongly labeled as ADHD, his meticulous nature, mistakenly identified as OCD, his black nails with transverse striations, an altered voice, and the presence of black stools. These indicators clarified his constitution and the corresponding remedy, arsenic album, although such connections might be obscure to those untrained in this field. Consequently, many diagnoses such as ADHD and OCD can remain inconclusive. I am documenting the symptoms in these images and how all symptoms point to a specific medicine as indicated by nature. This constitutional medicine was administered in the last week of August 2023. At the follow-up on February 14, 2024, the improvements were substantial. His teacher noted that he was more engaged in class activities, interacted more with peers, and his concentration had significantly improved. He could now sit patiently and complete 2 to 3 sheets of work, a previously challenging task. Additionally, he was independently matching pictures to words and enjoying painting. His episodes of anger and frustration had diminished, and when taken into his parents' lap, he no longer cried, a resistance he previously exhibited. His stools returned to a normal color and consistency, and there was a remarkable improvement in the appearance of his nails, with the black color and transverse striations disappearing. This case exemplifies how a standstill in progress for nearly 5 years could be dramatically reversed in just 6 months through constitutional medicine, a dynamized remedy indicated by nature. After more than 40 years in medical practice, I have found no other treatment as potent yet gentle as constitutional medicine. Therefore, we should not declare autism incurable. Constitutional medicine offers hope. Nature provides numerous clues for identifying remedies inherent within itself, insights that my homeopathic knowledge can grasp, yet often elude my allopathic training due to a lack of focus and specialized training in this vital area for identifying constitutional diagnoses. Here are some instances. Restlessness compels him to move from place to place, which leads to a diagnosis of arsenic album, effectively addressing the problem. Conventional medicine often labels this symptom as hyperactivity or attention deficit hyperactivity disorder, ADHD, which generally does not suggest a curative remedy, thus I consider it an unhelpful diagnosis. The unmistakable signature of nature is evident on nails and stool. The color of arsenic ranges from steel gray, which darkens when tarnished, to the colorless variety known as white arsenic. These are observed as black or gray spots and white transverse lines or striations on the nails, and white spots. Remarkably, these black or gray colors and transverse white lines and spots fade when dynamized arsenic album is administered to the boy, resulting in significant improvements in his autism symptoms. This illustrates the mystical and magical powers of nature, visible only to those with the requisite training, aptitude, and knowledge. Nature is signaling for help through these signs. His habit of keeping all his toys organized, even late into the night, is identified as fastidiousness, indicative of an arsenic constitution. Conversely, the conventional system might label this behavior as obsessive-compulsive disorder, OCD, likely leading to a diagnosis that offers no curative remedy. Whenever he is asked a question, his response in an altered or variable voice also points to a curable remedy. When these critical symptoms or signs are grouped together, they suggest a curable remedy. Nature advocates for cohesion rather than division. Arsenic is an element that can exhibit different colors depending on its chemical form and structure. In its pure form, arsenic appears as a steel gray color. However, when exposed to air or certain chemicals, it can tarnish or oxidize, causing it to darken in color. Additionally, arsenic can form compounds with other elements, resulting in various colors. One common compound is arsenic trioxide, also known as white arsenic or arsenic oxide. This compound is a white, odorless powder, hence the name white arsenic. So, the color of arsenic can vary from steel gray to white, depending on its form and the conditions under which it is observed. Upon review on April 26, 2024, he began to understand the concepts of acceptance and rejection for the first time, much to his father's delight. He now expresses joy by smiling and shows rejection by momentarily banging on walls, tables, or sofas. Previously, he had communicated rejection by pinching and biting his parents, behaviors he has since ceased. His teachers have noted improvements in mathematics and science, particularly in topics related to animals. However, he shows limited interest in languages and social sciences. His bouts of anger have nearly vanished, and his patience has markedly increased. Occasionally, he cries without any apparent reason, easily succumbing to tears when frustrated or sad. He also laughs easily, sometimes spasmodically or hysterically, even over trivial matters. Additionally, he is bashful and timid, often displaying shyness and a tendency to conceal his belongings. He demonstrates perseverance and persistence in pursuing things he desires. I am surprised to find that these behaviors align with the realm of arsenic constitutions he currently exhibits. This suggests that they are likely transient, indicating an urgent need to view these symptoms not merely as characteristics of autism, but as manifestations of a specific constitutional type. Understanding this constitutional etiology is crucial for effective treatment. With this, I conclude a detailed analysis of the first case of autism I have observed, noting improvements that have pleased his parents. This is the story of a 4-year-old boy who underwent traditional treatment for 6 months without any improvement in his condition. However, after 6 months of constitutional medication, he showed dramatic improvement. On March 15, 2023, at the age of 3 years and 1 month, his parents took him to a pediatric hospital. A pediatric neurologist identified his primary symptoms as speech delay, characterized by syllables such as nana and tatha, a vocabulary of fewer than 10 words, a poor response to his name, only intermittent eye contact, hyperactivity, and parent recognition. He did not indicate toilet needs and communicated his needs solely through gestures. He avoided socializing with other children and displayed behavioral issues like temper tantrums, head banging, and motor stereotypes. He was diagnosed with autistic traits. The treatment prescribed included occupational therapy, Xanoxa syrup, a medicine usually prescribed to control seizures, Cognicare syrup, and Trifer syrup. 4 months later, in July, a tablet of Sizodin 0.5 milligrams, a quarter tablet daily for the next 4 months, was added. This medicine is usually prescribed to treat schizophrenia and mania that affect the ability to think. Dietary restrictions included avoiding sugars, packaged food, and exposure to gadgets. By August 13, 2023, with no significant improvement following this therapy, they consulted me. The boy experienced constipation, passing stool every second or third day, with the first part of the stool being hard followed by softer stool. Frequent screaming, particularly in new places, was noted. His main diagnostic indicators for his constitution were black discoloration around the nails and constipation. Based on this, he was given a single dose of the constitutional medicine natrum muriaticum salt on August 13, 2023, and all other medications were discontinued. By the review on October 17, 2023, noticeable changes were observed. He began asking for his father even when he was at the office, established eye contact, started looking at faces directly instead of sideways, and began saying mom and dad. He started going to school voluntarily, cried less often in his sleep, and began to articulate his name and toilet needs. He also started asking for food, formed small sentences, and ceased screaming. By April 5, 2024, his parents were pleased with his progress. He maintained eye contact while talking, played with his sister, and had softer, more regular bowel movements. The monthly doses with increasing power from 30 ch to 1000 ch of natrum muriaticum had effected a dramatic change, contrasting sharply with the previous ineffective 4-medication regimen. His parents now see hope in a potential cure for autism, emphasizing the profound impact of the new constitutional approach. Parents, doctors, and various therapists involved in the care and well-being of an autistic child must not overlook critical signs, such as those observed on this child's fingernails. Most children exhibit similar signs around their fingernails, which provide unmistakable clues to potential treatments that could dramatically improve their condition. There is no excuse for missing these signs. The following pages will detail his treatment history and the significant, most vital black discoloration around nails. This case clearly illustrates that autism can be cured if a child's constitution is identified in the majority of cases, if not all. A father, having exhausted all available treatment options including homeopathy, sought my online advice on November 11, 2022, for his 10-year-old son's autism and hyperactivity. The primary issues were communication difficulties, absence of speech, and predominantly destructive behaviors such as spitting, throwing objects, banging doors in anger, kicking, pinching, pulling hair, cutting papers with scissors, plucking and shredding leaves, showing interest in cutting vegetables, and frequently washing his hands. Additional behaviors included licking objects, talking to himself, noise sensitivity leading to ear covering, excessive eating with a large appetite, very hard stools, and fears of enclosed spaces, darkness, and certain animals, specifically cats and hens. He also had difficulty swallowing solids. Based on these symptoms, I administered the constitutional medicine natrum muriaticum, a dynamized salt in a 30 ch potency, on November 12, 2022. The symptoms pointing to this remedy included frequent hand washing, hard stools, fear of enclosed spaces, difficulty swallowing solids, and black discoloration around his nails. A follow-up on March 29, 2023 showed improved calmness. He no longer banged his head against doors, and there was a reduction in kicking, pinching, and hair pulling. He expressed affection by hugging and kissing his parents and responded to his name during a phone call for the first time, bringing immense joy to his parents. By May 29, 2023, his eye contact had improved. During one of my online consultations, he greeted me with hello and responded to his name, although he continued to spit and throw things. On July 30, 2023, spitting decreased and he exhibited meticulousness, a trait characteristic of his salt constitution, by rechecking things repeatedly. As of April 1, 2024, his stools were softer and more frequent, 2 to 3 times daily. His appetite had normalized, and he took particular care in grooming, advising his father to shave regularly. He remains under treatment and I adjusted the medicine dose depending on his progress. He is showing gradual progress, which is encouraging given the numerous approaches tried until he was 10 years old. However, I note that progress is slower compared to other children, likely due to the late initiation of constitutional treatment. Black salt, also known as Kala Namak, Suleimani Namak or Himalayan black salt, is a type of volcanic rock salt mined in the Himalayas. It typically displays a pinkish-brown color due to iron sulfide. Rich in sulfur compounds, this salt is crucial for nail development. Unlike black salt, the color of sea salt ranges from white to gray, pink, or even black. The black discoloration around nails, often signaling a salt constitution, may not resemble the natural pinkish hue of black salt or the various colors of sea salt, as we have seen gray color of nails reflecting an arsenic constitution. Nature reflects white color of sea salt in body discharges, which are typically white or clear, resembling egg whites from the nose, expectorant from coughs or discharges from the urethra and vagina. Skin eruptions are similarly crusty and white and dandruff, which usually appear white, dry, scurfy, or powdery. Using salt in potentized or dynamized forms, rather than conventional material doses, may help improve these discolorations and address various health issues, including autism. Additionally, incorporating black salt in food can significantly reduce hair loss, primarily affecting the front part of the head. Children with a salt constitution often learn to talk and walk later than their peers, may struggle with reading, and might exhibit a nail-biting habit. Their salt intake can vary, sometimes consuming more and sometimes less. Subscribe to my channel Try Incurable and stay tuned for an intriguing presentation titled, "Will Black Patches Fade? Why Not?" Patients are receiving the most potent yet gentle medicine on earth. In the upcoming images, you'll discover how spiritual medicine not only cures black patches, but also ameliorates many other chronic conditions.
For those unfamiliar with the Constitution and constitutional medicine, a regrettable gap, as it is a self-healing method inspired by nature, I highly recommend watching my videos titled Nail Signs of Disease, Your Health Horoscope Part 1 and 2 and Unlock Dreams for Wellness Part 1 to 5. These are available on my Try Incurable channel on YouTube. Links to these videos can be found in the description box below.